Thank you very much for agreeing to talk to us. So, Monika Queisser, you are the head of social policy at the OECD and an expert on pension reform within the organization. And before joining the OECD, you were a member of the Financial Development Department at the World Bank in Washington, D.C. And my name is John Crowley. I'm the Chief of Section for Research Policy and Foresight in UNESCO. And among other things, I supervise the work of the UNESCO Inclusive Policy Lab, which is the host of this podcast, and which works on knowledge crowdsourcing and its translation into inequality-reducing policies. With more than 1,800 members and 700 experts from the knowledge, the public, and the social sectors, the lab is primarily concerned with connecting research and data to action on the ground. In addition to its online platform, the lab works through a chain of in-country projects to support shared audits of policies in terms of their inclusiveness, to enhance the flow and the use of evidence in inclusive policies, and to harness participatory data. We may not talk about all of that, but we'll certainly be referring to many aspects of the general terms of reference at the lab in light of the work that you're supervising at OECD. So obviously, given when we are discussing, this is a lot about what one might call the post-COVID-19 reset, which means one hopes at least, and certainly UNESCO and the OECD are committed to this institutionally, a reset along a more equitable path. The pandemic and the control measures taken in response to it have brought to light and exacerbated the inequalities that were already present in our societies. So simply going back to the status quo ante is unlikely to be adequate. And social protection is clearly key to countering the immediate effects of the crisis in ways that I'm sure we'll have the opportunity to discuss, as well as setting us on a more inclusive pattern for the long run once the immediate effects have been worked through. So we'd like to discuss with you some concrete measures implemented or recommended, or perhaps simply envisaged for uptake to allow for such a recovery. And I noted that you recently wrote about the pre-existing gaps in social protection provisions that are being exposed by the COVID-19 crisis. So if that's okay with you, I'd like to start by that theme. What would you regard as the most important gaps, many very long-standing and often well-known at some level, at least within expert communities, that have been really thrown into sharp light by the crisis and its economic implications?
Yes, absolutely. So the gaps in social protection were indeed long known and also feared to be widening over time, even in very rich OECD countries, which are known to have very comprehensive and very effective social protection systems. Now, why is this so? I think first it's maybe helpful to take a quick look at the history of social protection systems, the way they grew, and they were based on basically the assumption of a single earner, male-headed household where the man was working. He was providing for his wife, for his children. Social insurance was organized around this single earner, helping the family members to be insured along with the earning male. And then there was also assumption that people would be working throughout their careers, thus gaining pension entitlements over their career, and then retiring on a comfortable retirement income, which helped them also provide for their family. Now, this single earner family model is clearly an outdated one. We have more and more single parents, but we also have new developments which show that this stable employment assumption is no longer one that one can automatically make for the future. So when we were discussing pre-COVID already, when we were talking about digitalization, automation, gig work, platform workers, and so on, we kept talking already about the dangers of social protection systems not being able to provide accurately for these people, for workers increasingly hopping from gig to gig without getting proper entitlements, either for disability, which is, of course, the biggest risk for platform workers, for example, or in the longer term for pension entitlements. Now, what happened with COVID? Before we were looking at these gaps and kind of thinking, oh, this automation is coming, it's not really happening very quickly, but then it will be coming soon, and then there will be lots of people out of work, and what are we going to do? But it remained a little bit hypothetical. It was something that was out there in the future. Now COVID hit. Suddenly, with the shutdown of the economy, we're in a completely new situation. Suddenly, we have people who have nothing from one day to the next in certain sectors. Take the culture sectors, take restaurants, and some of the other workers, which we thought were very much in danger, were the ones that were in highest demand, like the Uber drivers, the food delivery people. Not Uber drivers, because I guess taxis and so on were not really in demand anymore in lockdown, but food delivery was. And suddenly we were talking about essential workers, which is a completely new classification, giving much more value to certain groups of workers. So social protection had suddenly become a very essential function for many workers. And we saw that in some sectors, self-employed people, for example, from one day to the next went to nothing. And so these gaps, we knew about them before, were suddenly brought out to the light in the COVID crisis. And I think what's also new about the COVID crisis is that we suddenly see social protection needs of people who were fairly well off before, who were not considered at risk. Take, for example, people working in culture, people working in event management, people working for big trade fairs. These were people who were making good living. Maybe they had their own company. Maybe they employed a few people. As self-employed people, they were outside of the system in many countries. So they were basically providing for their own insurance, but it wasn't really a problem because they were comfortably earning. So from one day to the next, they have zero earnings, but they're not even in the public system. So not only do they have no income, but they also, in order to continue to have social protection, they have to pay private health insurance contributions. They might have private pension arrangements, which also need to be paid. All that on top of even the fact that they have no more income to feed themselves and their family and pay their rent and so on.
That gives thought in two directions, and the two questions are quite different, but let me nonetheless ask them together. Vulnerability to the pandemic and the immediate circumstances of the pandemic, as you explained, affects certain categories of workers in specific ways due to the modalities by which social rights have been institutionalized in different countries at different times, with an emphasis in particular on the self-employed and small businesses. With respect to the recovery period, insofar as we can anticipate it, it's possible that at least some of these sectors might rebound. Obviously, not everyone will benefit, but some will. Your remarks invited two kinds of questions at somewhat different levels. One was about the contrast between the crisis phase, the lockdown and the immediate economic consequences of the lockdown, or the equivalent in countries that didn't strictly lock down, and the recovery period. And it's not obvious that vulnerability looking forward to the recovery will be the same. So I was just in your views on how, in particular, sectors like tourism and culture, the vulnerability of which to the lockdown period you defined very clearly, might benefit or not from the recovery which at some point will come. And then there was a second set of questions, which is about the differences between countries. You referred to the general background assumptions of welfare systems or social protection systems, which are common across the whole of Europe and North America and in many other places too. On the other hand, there are quite different social protection models within Western Europe, for instance. Three Worlds of Welfare Capitalism, to quote the title of a famous book. Do you see some of those models of social protection, which define rights in different ways and connect them differently, in particular to the tax system, for instance, as having proved more robust than others? Is there something to be learned from the specific modes of institutionalization of social rights?
Okay, so let's start with the first question. What's the future of certain sectors? I think to today it's very difficult to say how different sectors will be operating throughout the recovery. I think it is difficult to imagine that we would have a world without tourism, for example. I'm sure that there will be a return of tourism, and indeed some countries are already seeing this. Might the tourism be different if you take a country like France or many of the European countries that were hard hit, for example? People prefer to stay in the country, partly because they weren't even allowed to go outside of the country or because they felt insecure about going somewhere else. So we might see a different type of tourism, which is much more national and locally based. Will we also be seeing, for example, a revolution in airfares? We know that many of the airlines were very hard hit. So a lot of the tourism we saw around the world was very much based on very affordable plane tickets. If plane tickets are going to be less affordable, what does that mean? Who are the people who will be traveling? And will that make tourism even more national and local because it simply will be less affordable to go abroad? I don't think that these questions are questions concerning social protection, strictly speaking. These are much more questions of something I would almost call industrial policy, which has a bad name, but I think it is making a return now because governments are asking themselves these fundamental questions. How do we want to manage certain sectors? I will give you another example. Again, this is a European example, but we can talk about non-European countries later. There was a lot of outbreak of COVID cases in meat processing plants. Mm-hmm. Meat processing plants in Europe were always known, along with other agricultural plants, for example, in fruit picking and seasonal work in agriculture, as places which had bad work conditions, which were on the border of exploitation. People were not well paid. They relied very much on seasonal migrants, often from poorer Eastern European countries, like countries like France or Germany, relied on cheap labor coming either from Spain or from Eastern Europe. Then afterwards, it was said, well, even if these people are badly paid, it's still a big wage compared to what you could make in Bulgaria or Romania, for example. And it was implicitly kind of accepted that this was seasonal, this was not going to last. Suddenly, with the health risks, it was possible to very quickly have this discussion. And in Germany, for example, the law hasn't gone through yet, but there's a law in parliament that is trying to prohibit subcontracting in the meat processing industry. So I think this is an interesting example of how the world of work can be changing, triggered by COVID, because suddenly these health risks are making it a risk for everybody and not only the workers concerned. And suddenly policy is powerful and is active. I found that a very, very interesting development. So in the culture sector, that's the third sector I would like to mention, I think we have yet another issue. I think most countries would agree that the culture sector is one that should have preferential treatment because people like theater, people like music, like performances, but also museums and other cultural institutions. And there's different models out there in the world how culture is subsidized by the government or even by the private sector. And again, this is raising the question, what is the best way to protect cultural workers? Should they have unemployment benefits? Should they be included, even if they're freelancers and artists, should they be included in the formal pension system? All of these discussions have been around for many years, and countries have answered this in different ways. In some countries, self-employed people are completely integrated into the social protection system. In other countries, they have patchy protection. So again, this has triggered a more fundamental and structural discussion about how different groups of workers should be protected. Is that good for the first question?
Thank you. Very good.
Yeah. Okay. So for the second question, which models of social protection were more adapted to what was happening in the COVID crisis? There are clear differences in social protection systems across countries. We have some countries, like, for example, the United States, where social protection is very basic in terms of what is provided by the government or by state institutions, and there's a lot of reliance on employer-provided benefits. Now, the COVID crisis has triggered this, the COVID crisis has made it clear in a very dramatic sense what risks exist in such an employer-provided system, because the workers who were furloughed or made redundant in the United States due to the economic crisis also lost their health benefits. Now, that is just about the worst thing that can happen in a situation where there is massive health risk and people have to go to the hospital, people have to go see doctors, people have to go get tested, and so on. And we should not forget that COVID is not the only health problem that people can have, but that there's other health problems which are also need to be addressed. For example, cancer prevention, chronic diseases like diabetes, like hypertension, which have not been receiving the attention that they need on a permanent basis due to the COVID crisis. Already people were scared of going to the hospitals, but in addition, they lost their health insurance coverage. So this clearly shows the limits of employer provided social protection, in particular in the health area. Obviously, in a situation where many people are losing work and protection against risks that is somehow based on their employment relationships, whether it's in a social insurance setting or in an employer-based setting, those systems are best off that provide everybody with a basic income. So if you have the government paying everybody or providing even benefits in kind, such as food support or a health system such as the NHS, the National Health System in the UK, for example, which is there for the entire population, those systems are best off. So what we also saw in some of the countries which have patchy social protection with not good minimum income schemes, meaning social assistance, for example, we saw that already during the great financial crisis in Greece, in Spain, in Italy. A lot of countries took measures to speed up the introduction of minimum income schemes so that people would be provided at least with a minimum. Usually in social assistance schemes, you do tests for income or for assets to determine whether people are eligible for a benefit. This is something that can be administratively a bit cumbersome, and it can take some time. So during the COVID crisis, a lot of countries decided we're not even going to worry about this now. We're just going to make sure we get money to the people as quickly as possible. So that was another emergency measure that many countries introduced in order to make sure that people were provided for and didn't find themselves without any income at all.
Thank you. These issues are extremely important, and actually I had planned to discuss them at the end.
Okay, we can come back to that later if you want.
Come back to them. But what you just said does invite one immediate question, I think, even before we move to a somewhat different topic, which is precisely the status of these emergency measures, because you can interpret them two ways, obviously. And this is at some level almost a political forecast. There's no technical way of being sure. One possibility is to say that the emergency has really generated a shift in mindset that will be durable, in the same way as wars have traditionally transformed social protection systems by realigning perspectives and perceptions on citizenship after the First World War, after the Second World War in many European countries, which means that the concern that in the absence of conditionality, incentives to work would be destroyed has, at least for a period, gone away. Another possibility, of course, is that emergency measures get rolled back as soon as the emergency is ended, so that we can predict, at least as a hypothesis, that as soon as possible, systems will try to reintroduce the traditional conditionalities, the traditional means and asset tests and so on, probably in the name of incentives to work. I'm not asking you, obviously, to play prophet here, but if you had to judge based on your experience and knowledge, which of those two scenarios might be the most likely? How would you judge it as of now, September 2020?
I think the question of incentives to work is indeed being looked at a little bit differently now. First of all, what I think changed here is that the lockdown was something that was decided by governments. So I think governments also felt an obligation to not blame anybody for not being able to work for whatever reasons. And I think that's a new perspective, one that we haven't really seen in the past. And I think we had an almost uniform around the world attitude of governments to say we will do whatever it takes to make sure that things go well and that nobody is left behind, or try to ensure that people aren't left behind in this. Because the amounts of money that are being committed for people and for short-term work programs and for companies in different forms of support are unprecedented. So I think the whole issue of incentives has really been put on the back burner for now. Is it going to come back? I think it is already coming back slowly, because now that it is clear that we cannot put companies on short-term work support forever, the thorny question arises, how do you withdraw the support? How do you decide who should be supported longer? Which are the companies that should be slowly moving into a kind of normal situation again? What are the incentives for those companies to do so? Because it's a huge risk to take. Why should you be doing this if you're not sure that your company can survive? It's better to just kind of stay on a short-term work program and not take the risk of having reduced support. So I think the question of incentives is not only one that is posed for workers here, but also for companies. And I think that's also a little bit of a change, a little bit less individualistic view. In the long term, it's very difficult to say whether incentives for work are going to be in the center of preoccupations. There has been some discussion about basic income, but again, I think it hasn't been the main preoccupation in the crisis now.
Thank you. Thank you for those remarks and speculation. And I think it's actually good to be able to speculate while recognizing that the basis for speculation is a bit shaky. Not because we're going to predict anything, but because we need to be able to sketch possibilities and scenarios. And in that respect, I'm struck by the fact, this is the case in France particularly, but also in the UK, and I'm sure in other countries too, the time-limited nature of some of the support schemes that were created back in March means that there are some very dramatic cliff edges built into current policies, which will require either a huge risk, a macro risk, if governments decide to keep to the original timeline, or very expensive extensions if they don't. And clearly, all governments are hoping to avoid that dilemma because both options look very bad. But it's far from clear, given how the pandemic seems to be developing since the middle of the summer, whether governments will be able to avoid that dilemma. Mm-hmm. So yes, very, 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 very important issues. But I wanted to move, if you agree, to an aspect that you didn't really refer to so far, which is the gender dimension of all of this.
Yes. Mm-hmm.
It's well known that women, for a whole series of reasons, have been particularly hard hit because they're often employed in frontline sectors such as the health sector, which means that many women have been confronted simultaneously with massive pressure due to the emergency, health risks, and very difficult work-life balance issues, particularly in the context of school closures. And also a number of other changes, often connected to changing patterns of male employment as well, of which one spectacular and frightening indicator is the increase in domestic violence since the beginning of lockdown in, as far as I know, all countries, certainly in Western Europe. What comments would you have on that? And how do you see the gender dimension of social protection being part of the problem and or part of the solution looking forward?
There's two ways to look at this, and you can look at it from a positive standpoint and emphasize certain changes in gender inequality, which might actually be improved through the COVID crisis. Or you can look at it in a very negative way. Now, let's start with one of the very immediate impacts for families, which was the fact that during lockdown in many countries, everybody was finding themselves at home. And that meant that in those more traditional families, the father was no longer going to the office, but was spending time at home with the entire family and available to do more cooking, caring, and cleaning that is usually in many countries, or basically in all countries, done but in most part by women. So then the question was, were fathers actually going to do more housework and more homeschooling, for example, than they did before, and were they going to participate in this extra burden? And the overwhelming view that we heard from different countries was that this was throwing women back, that it was exacerbating income inequalities, that the lack of equal sharing in unpaid work was just going to be made worse through the situation, and that basically even though fathers were at home, they weren't going to do more. Now, early data we saw on this, and there was data from Germany, which showed that in fact there was a huge imbalance in unpaid work in families with children, with women doing far more work at home than men. But the additional burden was equally shared between fathers and mothers. So that was interesting. Mm-hmm. So that actually points to a situation where you can say, well, maybe we could also see this as a positive impulse when fathers start doing this and start doing more telework, and then maybe this is something that even beyond the COVID crisis will kind of start to tip the balance a little bit more in the direction of fathers taking on more family responsibilities. Also,
interesting finding. It immediately, of course, invites the question whether that data was stratified by social group, and if so, whether there were significant social differentiations in the role of fathers during lockdown. Intuitively, one imagines that there might have been, because there are very different family structures depending on levels of education and so on. But there could also be counterintuitive realities that we need to take note of. Do you know?
I haven't seen the raw data to know exactly how this worked between different socioeconomic groups. But one assumption is, of course, absolutely clear. One fact is clear, that not everybody can do telework. And those people who can do telework are usually those who are non-manual jobs, who are belong to higher socioeconomic groups. So there you already have a bias, that's for sure. But I think overall it's good news that fathers become more involved no matter which class they come from, because we know that throughout all socioeconomic classes, women are doing more of the unpaid work than men.
Are you looking at that systematically? You mentioned the German study, which sounds very interesting. Are you at the OECD looking across the whole membership of the organization at this kind of issue, or is that just...
Yes, this is something. So what we do at the OECD is we analyze time use data across countries. Very many countries have this type of data collection. It's a very complicated analysis, because what countries do is they ask people to keep journals every day and write down how many hours they spend doing what. And now to make this comparable across countries, we have to look at the details of these time journals. We have to look at how different activities were defined. Some countries define playing with children already as unpaid work, whereas others say it's leisure. So you have to basically go into very minute detail to harmonize all of this. But this is something that we do at the OECD in regular intervals. And it's become a very important part of the argument why family policy is important, and why without better balancing of unpaid work, we will never arrive at a better balance in paid work between men and women. And we will also have great difficulties in reducing the gender pay gap, which is a direct consequence of the imbalance in both unpaid and paid work.
Thanks. And in terms of social protection, how do you see that connection? Are there social protection measures that you would note critically as making these kinds of problems worse because of, for instance, say, lower pension entitlements for women on average due to different career paths and so on? So the social protection system may work as an aggravating factor to pre-existing inequalities at the primary level. Or conversely, do you have examples to point to of really positive social protection measures that can compensate for the inequalities and perhaps even serve to push back against them?
I think it depends first what you expect from social protection. If you think that social protection is there to equalize things that have gone wrong in the labor market, you're going to have a very hard time to provide good social protection. So this is a discussion that regularly comes up when we look at gender imbalances and gender gaps in pensions, for example. And some countries have enormous gender pension gaps, which are a direct consequence of the fact that women have stopped working over a long time, that they or worked only part-time, very few hours, that they made much less money even when working over a longer career. And all of that accumulates and turns out at the end to be a very large gender pension gap. Now, we believe at the OECD that the answer to this cannot be for social protection to basically undo all of this. It's just simply, it's too big a task for social protection systems. So the answer has to be that everybody, men and women, should be earning their own rights in the labor market and have the possibility to participate fully according to their wishes and to share also these work responsibilities over an entire career. And so you can have social protection systems which favor, through, for example, individual taxation, the earning of own rights and working as an own decision on an individual basis. But then there are some countries that have splitting arrangements in taxation where it's favored that one person earns a lot of money and the other person earns as little as possible, because the money of the person who earns a lot gets distributed over the entire family, and then the tax burden is very small. So if you have this type of family taxation model, then you're giving it incentives for second earners to participate very little in the labor market. Another example is and this is something that's part of the single earner male household head model. When you insure the entire family on the basis of just one person contributing to the system, then that's very nice for the family because they have health insurance and disability insurance and so on without making any extra contributions. But of course, it doesn't really entice people, in that case mostly women, because those are the ones who make less money, to participate in the labor market in their own rights. Another example of a social protection system that favors better sharing even of unpaid work is parental leave. More and more countries have been moving to systems where parental leave, which is not to be confused with maternity or paternity leave around the moment of when a child is born, but parental leave, which is over a few years or months. In Scandinavian countries, it's often a year or more, that gets shared between fathers and mothers, and that there's at least a few months of this leave which is non-transferable and only available for fathers. And with this type of model, which is increasingly common in many countries, you can kind of introduce the much more sharing of family responsibilities when fathers stay at home, when they take care of their children. It also has a longer-term impact of better sharing of unpaid work.
Interestingly, that was on the radio just this morning in France, where extending paternal leave. It's not the same thing as parental leave, as you explained, is a current pre-legislative project that might or might not end up getting adopted. But it's interesting that what you say chimes with today's news as of 10th of September. Thank you very much for those comments on the gender dimensions. We noted that last year during another podcast you mentioned in conversation the social protection risks of an increasingly digital and informal economy, sectors that have undergone particular pressures and in some respects expanded in the COVID economy, particularly perhaps in developing countries, but also in other parts of the world. How do you see, in light of how you're looking at the issue pre-pandemic, the way in which the pandemic has opened up or, on the contrary, amplified new opportunities or pre-existing problems in the digital/informal economy, which, of course, is also in some ways, at least in some sectors, a rather deterritorialized and globalized economy?
Well, partly I think we've already addressed that in the beginning, talking about self-employed people and gig workers and people who drop out of the employment-based social protection systems that are based on stable employment relationships. So the digitalization and automation, this is actually two different effects, but digitalization has favored the emergence of a very mobile workforce of gig workers who work in very short-term contracts and are often operating outside of national systems. You could have a graphic designer who is based in India and who provides for very small amounts of money some services overnight to somebody who is in the UK, for example, as the client. And since the clients are all over the world and there's different jurisdictions responsible, it's very difficult to have a obligatory social insurance or social protection system that is somehow based on contributions to such systems. Now, there are some ideas out there for a global social security system where everybody would pay a little bit more on a contract, and that would somehow go into a global fund, and then the global fund would make transfers to money to some of the national systems where the people are based who are providing these services, the workers essentially, to make sure that then they get some pension entitlements and some credits in the national social security systems. With digitalization, the advantage could be that all transactions are trackable and traceable in a much better way than it used to be. So, and you have some good examples. For example, there's a very interesting example which is often mentioned in Indonesia, where the people who are motor taxi drivers are obviously most of them in the informal sector, and they take risks because often they have not even any kind of accident or health insurance. And then the client also takes a risk. But there's an app which works like an Uber app or a taxi app, which many companies have nowadays. And so when you ask for a ride and you book a ride with a driver, for the duration of the ride, both you and the driver are automatically insured through accident insurance. So that's a good example where you use technology to make a very simple way of having an insurance connection just for the duration of the ride without having to have a cumbersome process of people registering and being there and contributing on a regular basis. But it's something unbureaucratic, and it's something that other countries have been looking into, particularly in developing countries where you often don't have the infrastructure and very large informal sectors. This could be something where you use technology to expand systems also in the informal sector.
Thank you. Interesting example. Now, I'd like to come back to what we started discussing earlier, which was basic income. Mm-hmm. As you already noted, there's been a spike of interest in basic income schemes of various kinds. There's also been a lot of practical experience of emergency creation of such schemes, even where they were not part of the pre-existing package, and perhaps even went contrary to the spirit in which social protection systems had traditionally been developed. At the same time, there are a million varieties of basic income, even more than of tomato ketchup. And it's quite important to distinguish the different aspects depending on whether this is seen more as a citizen entitlement, more as an income support scheme with a minimum character, whether it is completely unconditional or inscribed in various kinds of conditionality, and so on. The extent to which it is taxable, the extent to which it can be combined with income from work, and so on. Obviously, the unconditional universal citizen basic income at more than subsistence level is just one version of this, which doesn't really exist anymore, but is popular with some theorists. How would you set that wide range of options within the real world solutions that you've seen emerging in response to the crisis? And do you think this is something that beyond the emergency and beyond the places that have been able to find the political support for it in the emergency context, do you think this is something that could be generalized as a potential model for how to respond to some of the deficiencies of employment-based and, even worse, employer-based social protection?
Thank you very much, John, for pointing out that there's a lot of confusion around the discussion of universal basic income, because as you said, it has to be universal, it has to be basic and unconditional, basically. That's what the characteristic of this model is for universal basic income. In fact, many models, many schemes which are advertised as such, even by governments, turn out to be minimum income schemes, which are targeted either to particular groups, for example, young people or old people. Many countries, in many particularly emerging economies or developing countries, mostly any minimum income schemes are pretty much limited to very older people, because, and even then they're just very basic, because there's a kind of recognition that it's impossible for older people to work, and that they really are a particularly vulnerable group. But very often, in fact, these minimum income schemes are schemes that are based on conditionalities, on income testing, on asset testing, and only are there for a certain group of the population. The real definition of universal basic income is almost kind of an utopian one, meaning that you would pay everybody in the country an income which is basically just above poverty level, to make sure that they can still sustain themselves and eat, and then are not forced necessarily to go out and work, that there's much more liberty in deciding how you work or not. And indeed, those recent experiments that have been done, for example, in Finland, were there to test whether people would still go out and try to find work, and if they got a basic income, or whether they would then just content themselves with that income stream and say, I don't actually need more and I'm not going to look for work. So it wasn't really to test whether this is the best thing to do, or whether this was going to replace any other benefits, but it was really an experiment with a relatively limited scale of people to see how they would react. And pretty much they didn't find much difference in behavior, except that people were less stressed when they received the basic income and were overall slightly happier. But apart from that, they didn't find any huge differences. Now, I think it's a wonderful idea. It sounds like something that everybody should be for and strive to introduce. But there's a big debate also what the level of such a basic income would be. Because just being above the poverty level is certainly something that's not super attractive, I would say, but it's still something that's very expensive according to our calculations. We at the OECD, we did a few simulations and came up with different limits that we would set for such an income, and looked at how much that would cost in terms of reshifting all kinds of different benefits, and how much tax increases that would still require. And it turned out that for most reasonable assumptions, it would actually require quite a bit of tax increases, and still you would not arrive at hugely generous benefits. Now, if you, of course, say that you're going to switch your entire social protection system to basic income, including pensions, then you could have quite a mass of money to redistribute. But I think it's very difficult for most people to envisage that you would get only a very basic pension instead of something that's earnings related. Now, there are some OECD countries which traditionally have had that. If you take a country like New Zealand, for example, there is only a basic pension and there's no obligation to have anything beyond that, although most people have additional savings and employer-based schemes. So it's an interesting debate, but one that lacks clarification, lacks clarity, and turns out to be very often about social assistance schemes rather than really about a universal basic income.
Yeah, it also has knock-on consequences on things like asset prices that have to be taken into consideration. If it just leads, for instance, to inflation of housing costs through various market mechanisms, it can easily end up being a kind of vicious circle.
Yes.
Where the money gained is immediately lost through various kinds of scarcities. Anyway, do you think that in terms of real evidence from actual applications of particular schemes with their different characteristics, it's possible now to make a judgment on what works and what doesn't, or is the evidence just still too limited and the timeline too short?
What works, what doesn't, in which respect? For basic income?
Yeah, in terms of how to design a basic income scheme that in the real world, given all the constraints, can provide tangible benefits and remain affordable within the political and economic constraints.
I think it's very hard to say that because it all depends on the scope, on the level, and on the funding sources that are at disposal of different countries. And there were some instances where very rich countries, I believe Alaska has a basic income, which was basically funded out of oil revenues, where everybody received a basic benefit. That's, of course, if you have a jurisdiction, a country or a region or a state which has a very stable source of money and has enough and has maybe also not too many citizens that you can afford to pay basic income, that's very good. But it's hard to see, for example, how a large emerging economy, I don't know, take Mexico or take India, could pay a meaningful basic income to everybody. And when I say meaningful, would be really that this is something that is more than just a token cash benefit, but really an income that enables people to maybe not live in luxury, but that is something that fulfills the objectives of dignity and having a basic the possibility of funding what you need in order to have a proper living. So it's difficult to see how this could be done at a large scale. The next question is also, would such a basic income replace all the benefits that social protection systems have integrated over the years? And I believe for good reason. There are special benefits for parents with children because their needs are higher. There are special benefits for people who have disabilities because they have specific needs that other people don't have. There's specific variations in benefits which have been introduced in order to be able to respond to specific needs of vulnerable groups in all countries. Now, would a basic income just say everybody's the same, everybody gets the same regardless? Or would it be a basic income that in addition provides all of those other benefits? And if the answer is yes to that second question, then of course it becomes even more expensive. So it's kind of hard to see how this could work in practice in terms of having something that is really meaningful. I think you could devise models of paying a basic income to everybody, but I'm sure that many people would be disappointed because it wouldn't be at the level what they imagine. The experiments that are out there now, there's another one, I believe in Germany, where everybody gets paid €1,000 per month. That's wonderful, but could this be possible at a large scale? And would, for example, people be ready to abolish certain other systems like pensions to say then everybody gets €1,000? Then that could change the situation. But I'm not quite sure that people would be ready, and particularly higher income people for whom a basic income would be a very, very small replacement of their previous income, that they would be ready to go for that.
Certainly, and thank you very much for going into detail on it. I think this points to the fact that this is an area where many organizations, OECD, UNESCO, many others, probably have a shared interest in developing clearer agendas, perhaps frameworks for experimentation, frameworks for learning from experimentation, not because there's an existing prescription that could be rolled out. You've explained very clearly that there isn't, but because the issues around the idea of a basic income, including the known problems with excessive conditionality, high administrative costs, non-take-up, discriminatory processes within social protection systems, poor coverage when systems are too complex and so on, and the kinds of social impacts that have been seen from the pandemic crisis point to the need, at least minimally, to rethink things. Mm-hmm. And perhaps, depending on whether the rethinking is convincing, test options in the real world, and perhaps even move to possibly radical policy change on the basis of successful experimentations. That's a lot of steps down the line, but if we never start, we'll never get to the following steps.
Yeah, but I think it's already happening. I mean, there's different experiments running which look at different aspects of this whole equation, and there's just a new one starting now in Germany. I think they're with the German Institute for Economic Research, which is supposed to evaluate the experiment, which should be very, very interesting. And so I think we just, as you say, we would have to go step by step to take a look at what are the different issues connected to this, and how far are societies also willing to go in terms of making such payments equal, and then replacing other systems with. And for me, that's the biggest question. You know, you take a country like Australia. Australia does not have social insurance; doesn't exist. And casual workers are paid a wage supplement to make up for the fact that they don't have employer-based social protection, for example. It's very interesting. Now, would you go to a European country and tell them, we think it's a good idea to abolish social insurance and just have a basic benefit, or just means-tested public benefits, and everything else is private? I think that would not go very far. So we also have to take account of the fact that each country has its grown social insurance, social protection, or social assistance system. But one thing that has become very clear through the COVID crisis, I think, is that to have no minimum income scheme in countries is no longer an acceptable way to go. So the fact that there were people who found themselves without any income whatsoever, even in rich countries, I think was a shock to many people around the world. And even in rich countries, you would suddenly see people lining up for food assistance, which is something that really some shockwaves.
Thank you very much. This has been a great conversation. I think we could probably continue, but unfortunately our time is up. But I really enjoyed it, and I hope we'll have the opportunity to talk again